Hi everyone, welcome back to my channel. My name is Dr. Adazayon, your OBGYN Talks with Dr. Adazayon. I'm back again today to talk about some practices we carry out on our babies that are harmful, may cause babies to have sickness or die. That is neonatal morbidity or mortality. And these practices include care of the umbilical cord. You will see a woman that has given birth. You know that cord, the umbilical cord that is attached to the stomach of that baby. It is what is connected from that baby to the mother, and that's what the baby was using to feed when he was inside the mother's womb, that is in utero. So when the baby is born, the nurses or doctors sever it, will cut it and tie it and make sure that it does not bleed. Now, you're supposed to take care of that umbilical cord so that the baby will not have infection introduced into his or her system, because that cord is still open even at birth. So if you don't take care of it, you may introduce infection into that your baby through that cord. And how do you take care of it? You are expected to wash your hand and every day rub chlorhexidine gel from the root of that umbilical cord to the tip. From the root to the tip, you rub it and smear it with chlorhexidine gel. You're supposed to do with chlorhexidine gel once a day. Now, but if you don't have chlorhexidine gel, you should use methylated spirit. Methylated spirit. That methylated spirit used with sterile cotton wool. Soak the cotton wool and hold the umbilical cord. Clean it from the root towards the tip. All the umbilical cord stump should be cleaned. When you do this properly, the umbilical cord should be dry. It should not be wet and it should not have any odor. But if you don't do it properly, it will be wet and it will be smelling. When it's smelling, you're not doing a good job. That umbilical cord, when it's cleaned and taken care of very well, should fall off between 5 to 7 days. So take care of it very well. Some mothers go on to rub toothpaste on the umbilical cord. That is not proper. That is not proper. Don't rub toothpaste on your baby's umbilical cord. You are going to complicate that. It is not proper because you may introduce infection into that baby. Don't rub toothpaste. Now, some others, especially in the village, go on to rub cow dung, cow feces, haba. That is not fair. Don't rub cow feces on the umbilical cord. The umbilical cord should be cleaned with chlorhexidine gel or methylated spirit. Nothing more, nothing less. Please help us take care of those children. Now, secondly, you will see a mother having given birth to a beautifully created baby from God, and the next thing they'll do is to start rubbing otangele. Igbos call it otangele. They'll start rubbing lead. They'll start rubbing lead on the eyelids of that baby. That is lead. If it enters into that baby's eye, it may melt the cornea. And that baby will go blind. Do you want your baby to go blind? Please don't rub lead on our baby's eye. We do not want that. Leave our baby's eye alone. They are already beautiful. Now, so the third one, you will see a woman that has given birth. His eye is yellow. Instead of taking that baby to the hospital, you start giving glucose in water. Glucose in water. That glucose you are giving to that baby will not do anything. It would rather allow that bilirubin, that jaundice, the yellowness of the eye is called jaundice. It will rather allow it to increase, and before you know it, that baby becomes imbecile, because that bilirubin will enter, that jaundice will enter the brain, and the baby will become imbecile and start drooling saliva, and you start cursing people. No, you are the cause. If you see a baby or your neighbor's baby that the eye is yellow, please take them to the hospital. We put them under lights that will call phototherapy or fire flyer. Between 3 to 5 days, you're already home. Everything is resolved and no complication on the baby. But if you go on to give glucose in water, that baby may have a problem. So please, take that baby to the hospital. For some other women, you give birth and you found out that your baby's clitoris is big and you start rubbing Vaseline. Leave that clitoris alone. You are doing genital manipulation. Leave that clitoris alone. Leave it the way God created it. When we give birth to female babies early, it will be bigger. But with time as they grow, you will find out that it's smaller. Stop rubbing anything on our baby's clitoris. And don't forget, female genital mutilation is not encouraged. Don't mutilate our baby's genitals, our baby girl's genitals. Leave them the way they are created. Thank you. I will come again for the conclusion of this episode. If you have not subscribed, you're not doing the right thing. Subscribe to my YouTube channel at Dr. Kiruka Bridget, OBGYN Talks with Dr. Ada Zion. Follow my Facebook page. Share this video. Let others hear it and benefit. We still have a lot to discuss.